Once again, welcome to the Awareness and Wisdom Podcast, a podcast that drives into several issues. It looks after several issues concerning agriculture, business, health, religious issues. And in today's podcast, we want to talk about diabetes. But before we continue, remember with me, Rahab Bungogo. And in the studio, I have a guest here where I want to talk about diabetes as a disease. Welcome, sir.
Thank you.
Maybe may people know you.
Well, I am Hopu Ombea.
Yeah.
I'm actually a doctor
Hmm.
um, in Gracious Hospital here in Manje,
Hmm.
Blantyre. That is in Blantyre.
Yeah, so in today's podcast, we want to talk about diabetes. Many people nowadays are suffering from diabetes, maybe, but they don't know what they can do, maybe what measures they can follow. So maybe first of all, our fellow listeners maybe should understand what diabetes is.
Well, uh, what people should know
Mm.
about diabetes is that firstly, diabetes is a serious disease,
Yeah,
and it happens when a body does not make enough insulin or cannot use it well.
yeah,
So this may cause high levels of glucose to build up in the blood,
yeah.
so also known as blood sugar.
Mm.
So as a result, the body does not work like it should be.
Yeah.
Yeah, sure.
So maybe others are questioning, but relax, we are going two stages. Be there. What are some of the primary maybe factors for developing diabetes?
Well, some primary factors that can cause a person to suffer from diabetes
Yeah.
is it can issues like about environmental factors.
Mm.
When you are living in an environment that where there's cause of infections like a virus,
Yeah.
it can also affect someone to suffer
Mm.
from diabetes, like infections like environment that is very toxic.
Mm.
Yeah, like industries, places like industries, they produce some toxic substances. So
Yeah.
those toxic substances, when a person breathes it, at the end that person can suffer, also can be a victim to diabetes.
Mm.
And also it can also um, because of physical inactivity,
Mm.
and also it can have factors like diet, consuming high sugar.
Yeah.
So this may be the primary causes of diabetes. When someone is taking food rich
Mm.
in high sugar,
Yeah.
this may lead to high sugar levels in the blood.
Mm.
So at the end, it can trigger uh, uh, high blood cells in the blood, which at the end
Mm.
will cause a lot of insulin
Mm.
to be released.
Yeah. So maybe what can be some of the symptoms that our listeners today maybe should know about diabetes?
Well, there are some symptoms that a person can know,
Mm.
and they are simple.
Yeah.
Yeah, when a person is feeling thirsty,
Mm.
and it is not as thirsty as we used to feel,
Mm.
but this one is a bit more, I can say, more like advanced.
Yeah.
When a person is having thirsty
Mm.
time and time again frequently, this also can be a symptom to diabetes.
Mm.
And also frequent urination is also another a symptom to diabetes,
Yeah.
because it's like the body, when a body has produced more sugar,
Yeah.
it's like a certain process. It makes like the body cannot use more. It's like the body produces more water outside the body,
Yeah.
so a person might having problem with
Mm.
to urinate frequently.
Yeah.
And also someone can feel tired,
Mm.
feeling tiredness and abnormally.
Mm.
Yeah, just feeling like you are tired, you're waking up in the morning, yeah, feel
Mm.
like you are just tired.
Yeah.
And in the afternoon, so this also can be a symptom to diabetes.
Yeah. But I think other people say that maybe when you wake up tired, like early in the morning, people be like, maybe it's because of the dreams, like maybe you were chased by someone.
Yeah. Of course,
Yeah.
yeah. Of course, we can take it as like that.
Yeah.
But here, you see, like the tiredness I'm talking about here
Yeah.
is okay. A person cannot wake up daily
Yeah.
being tired.
Mm.
No, it's impossible. But this tiredness is like is abnormal.
Mm.
Whether we can develop tiredness when we have sometimes when we have worked much harder.
Mm.
But this tiredness, a person can just
Mm.
maybe I've just given an example that a person can just wake up
Mm.
from bed and he's feeling tired or she's feeling tired.
Yes.
But in the afternoon, before you have just maybe started working,
Mm.
you can be feeling some tiredness abnormally.
Yeah.
You can be also wondering, say, what is this coming from?
Mm.
I haven't even started working yet. So even you can spend the whole day or even half a day feeling that tiredness.
Mm.
So this can be a good symptom to diabetes. So when a person also is feeling hungry,
Yeah.
so I can say that also that's also a symptom.
Yeah.
Also, someone can experience a weight loss. Also, when your skin is dry,
Mm.
that's also a symptom to um, diabetes.
Yeah.
And also, one of the important symptom is uh, having
Mm.
um, you can it's, loss of vision. It's
Mm.
like you can see but not clearly.
Yeah.
It's like a blur vision. So you can differentiate to say at the face you are seeing clearly, but when you are having this symptom to say that you have been you are developing diabetes,
Mm.
you can be losing sight.
Mm.
And also some people can have sores, uh, but that do not heal
Mm.
on their skins.
Yeah.
So when you are having these sores that you cannot heal,
Mm.
just know that you are also a victim to diabetes.
Yeah.
Yeah, sure. So those are the major symptoms of diabetes.
Yeah. So maybe should we say that diabetes is inherited, or maybe what really happens? Should we say that diabetes can be inherited?
Yeah, diabetes can be inherited, a family history.
Yeah.
So if someone in your family
Mm.
had a diabetes,
Mm.
it can also due to like you know person genes.
Mm.
A person can also suffer
Mm.
from diabetes. So a
Yeah.
family history, if someone in your family had the diabetes at first, and you too, you
Mm.
can suffer. So
Mm.
it's like a uh, issue for or issue of genes.
Mm.
So if you can develop that gene, if your mother can pass that gene to you,
Mm.
likely when you are growing up, you can also have
Mm.
diabetes.
Yeah.
Sure. So it's very passive. I can say it's very passive.
Yeah. So maybe other listeners can be like, hey, this was the part I was waiting for. Maybe I should ask you as a doctor, maybe what can be some of the foods that people are consuming but they are high level, causing or leading to diabetes?
Well, there's more food that are rich in more sugar. There, I can say foods like there are some foods that are like the let me give an example, a simple example like a cake.
Hmm.
A cake, it has a certain layer,
Yeah.
a certain layer on the upper layer, like that is white. That
Yeah.
white, uh, that white part. If a person can consume that part, it carries a lot of sugar.
Yeah.
So that when a person consumes that regularly,
Mm.
so he or she might at the end develop uh, like having it's like you increase sugar levels in the blood.
Yeah.
And also if a person is taking foods like there are also some biscuit,
Yeah.
they are also a bit they have a high level a high level of sugar.
Yeah.
So if a person is consuming this again and again, at the end, a person can have uh, symptoms of
Yeah.
diabetes. And also, if a person is drinking a lot of, is drinking, it's like he's a bit addicted to tea.
Yeah.
Because there are some people that can drink tea,
Mm.
but they might be put in that put more sugar.
Yeah.
But there are some that can say that I think I don't feel any sweetness, but I have to add some sugar. So if you put more sugar in that in your tea, at
Yeah.
the end you might find out yourself that
Mm.
you are suffering from diabetes. So far,
Yeah.
those are the type of food that most people. I've just mentioned the type of food that most people are likely
Yeah.
do take to they consume regularly.
Yeah.
Also, there are some also sweets.
Yeah.
So it's not advisable for one to consume sweets when
Yeah.
you are hungry. It's like when you are consuming sweets,
Mm.
uh, when you are hungry, let's say you haven't eaten the whole day and you
Mm.
are just starting to eat with sweets.
Yeah.
So at the end, they had hydrochloric acid in the stomach might be released, and at the end might act on uh, on that sugar. So this at the end may diffuse into the blood at the end, which can result the blood to have more sugar levels.
Yeah. And maybe you have talked about the cake. Should we say that they maybe like they leave like the cream
Mm.
on the upper part?
Hmm.
Maybe is that the that thing you want to mean that it's maybe it's sugary?
Yes, exactly. And
Yeah.
the way they cook the cake is like
Mm.
they I don't know how they make it, but that
Mm.
layer itself,
Yeah.
the upper part layer, is where now it is more sugary. So that part is where most people say,
Mm.
I like this part,
Yes.
I like this part since it's sweet, you know.
Yeah.
So when someone has consumed the whole the whole part, that means a person can put his life in danger since
Yeah.
that sugar
Mm.
part can at the end diffuse in his or her blood at the
Yeah.
end can cause diabetes.
Yeah. Okay, so maybe there can be other listeners, maybe suffering from diabetes, or maybe their relatives. So maybe they need to know something. Maybe what are some of the foods, good foods, maybe these people suffering from diabetes can be maybe taking now.
All right. There are variety of foods that people suffering from diabetes
Yeah.
must take, and here are the list of recommended type of food that they should be taking.
Hmm.
So we have talked about uh, foods that they must stop
Yeah.
consuming that contain a lot of sugar.
Yeah.
So they might instead of eating those sugars, that sugary food, they might take there are some we group them in there are foods
Yeah.
that falls under category of carbohydrates.
Mm.
So foods that falls under category of carbohydrates like whole grains.
Yeah.
So whole grains is like examples of like brown rice.
Yeah.
So whole grain pasta, wheat bread,
Mm.
those foods that they contain zero sugar.
Yeah.
So those are the recommended. And also I talked about the big biscuits that are they are more sugary.
Yeah.
And also that the companies there are some companies that they
Mm.
make some biscuits
Mm.
that people suffering from diabetes must take.
Mm.
So those biscuits are the ones that are recommended. They contain zero sugar,
Yeah.
so it's like to help their health to in order to regain. So it's like you are suffering diabetes at the same time. You have to take the food which can reduce sugar.
Yeah.
So also another food that a person can suffering from diabetes must take
Yeah.
is vegetables.
Mm.
Vegetables like I'm talking about leafy greens.
Yeah.
There's broccoli and also
Mm.
peppers. peppers or carrots. So
Yeah.
carrots can also help
Yeah.
to in order to a person suffering from
Yeah.
diabetes can also help him or her
Mm.
to reduce sugar levels.
Mm.
So all the type of food that contains
Mm.
less sugar content
Yeah.
is the one advisable for someone who is suffering from diabetes to
Mm.
take or to consume.
Yeah.
Also fruits also are the advisable
Mm.
for someone who is suffering from diabetes to take, like
Mm.
berries. We have citrus fruits,
Yes.
we have apples. So those are kinds of fruits that as a person suffering from diabetes must take.
Yeah.
A person can also ask us to say, can legume also be the basic food? So
Yeah.
yes, legumes they are also the basic food that
Mm.
a person should also take.
Yeah.
So like black beans.
Mm.
So others say call kidney beans. So
Mm.
beans they are also advisable for someone to consume.
Mm.
So, but when we go to protein, so I've talked with that I was listing foods that are falling under the category of carbohydrates,
Yeah.
and a person can say I cannot be eating uh, vegetables, fruits
Mm.
only. What about if foods that falls under the category of proteins? So in so protein foods like
Yeah.
meat,
Mm.
chicken, turkey, fish.
Mm.
So fatty fish, most especially, a
Mm.
person can take this kind of food
Mm.
to uh, to eat.
Yeah.
So milk,
Mm.
yogurt, cheese is also advisable
Yeah.
because since at the end they have no uh, much content of sugar in it. Also, a person can
Mm.
eat nuts and seeds.
Yeah.
So these are also a person can take nuts and seeds.
Yeah.
So also there are also heavy fat. I mean heavy fast foods
Yeah.
that a person can also eat.
Mm.
They are not grouped in category of fruits, but they just put like a person since they appear
Yeah.
once in a year. A fruit,
Mm.
like avocado.
Mm.
Yeah. So a person can also instead of using cooking oil, I mean kukoma, that is cooking oil.
Mm.
Person can prefer using olive oil.
Mm.
So
Good things.
yeah, good things, So I think this is also the basic oil that is
Mm.
recommended. So olive
Yeah.
oil. So these are the most healthy fats that a person can consume.
Yeah.
So fiber rich foods like I've said about legumes,
Yeah.
a person should not miss taking this because
Mm.
at the end it has some contents, nutrients which are they boost the immune system, which at the end they might it's like they suck
Mm.
those sugar in the blood.
Yeah.
So these are the foods recommended. So
Yeah.
a person should uh, be recommended to take a lot of water.
Yeah.
Yeah, should take a lot of water. Should
Mm.
uh, of course everyone likes tea, but
Mm.
it's not recommended to put more sugar in it,
Yeah.
since more sugar it leads to diabetes.
But they should be taking the pure water.
Yeah, pure water is
Yeah.
more advisable
Mm.
to use or to drink.
Yeah.
Yeah, sure. So um foods to limit, someone should avoid
Yeah.
to take much food like food like sugary drinks
Mm.
like juice.
Mm.
So there are soda also.
The soda that we know.
Yes, soda that we know.
Yeah.
Yeah, I think it's basic in nature, so
Mm.
it has to do with the uh, to trigger also diabetes.
Yeah.
Refined carbohydrates
Mm.
like white bread. We talked about white bread.
Mm.
Since what the bread we eat has no sugar in it,
Mm.
so a a person can eat the whole loaf of bread,
Mm.
but it can never affect him.
Yeah.
And processed meats is
Mm.
also it's not advisable,
Mm.
like hot dogs,
Mm.
sausages, since
Mm.
this contains uh, some fats that can trigger also diabetes.
Yeah.
Fried foods,
Mm.
so too much oil is also not healthy.
Mm.
Uh, so it's not advisable for someone to eat.
Mm.
So it's
Regularly.
like you are in this situation, you are
Yeah.
already suffering diabetes.
Mm.
So if you can reduce the intake of fried foods, processed foods like I've just mentioned, the hot dogs,
Mm.
if you reduce this, it can help you. Maybe at the future you can start also eating the same food, but
Mm.
for you not to increase uh, the
Mm.
sugar in your blood, and also to weaken your system, you have not to take this type of food
Yeah.
when you are suffering from diabetes.
Mm.
So food rich in that is high in saturated
Mm.
trans fats like butter
Mm.
also is not advisable for someone who is suffering from
Mm.
diabetes.
Yes.
So a person should avoid this type of food.
Yeah. So maybe we as people in general just know that there's diabetes. Should we say that maybe diabetes is grouped or it has categories? And maybe if it has, what are they? And maybe how do they differ?
Okay. I'll explain in based also to in terms of food that also someone should take. There are types of diabetes, and there are two types of diabetes. Number one type is type 1 diabetes. Type 1 diabetes happens when the body stops making insulin anymore. So at this stage, um, when insulin has been stopped to when your body has stopped producing insulin, so also a person should also uh, take the specific type of food. So we have mentioned the most important food that a person should take. So at the type 1, a person is advisable to take vegetables. So at least to in order to help the body to manage to produce insulin again. Fruits is also advised. Whole grains. So I will not be mentioning examples since I've already mentioned the examples. Protein sources, so also healthy fats, and also low fatty daily. So these are the examples of like milk. We mentioned it earlier, milk, yogurt, cheese. So specific recommendation for type 1 diabetes is balanced meals is vital to check it up, and also frequent meals. You should do A person should do uh, having meals in time. So few meals like 2 to 3 snacks to maintain blood sugar level. So avoid also sugary drinks and the foods high high in sugar level content. Since when we have talked about uh, type 1, to say when it happens when the body has stopped to produce more insulin. So I mean it has stopped completely to produce insulin. So when person is taking a lot of sugar, at the end a person might suffer very uh, very hard, very bad of diabetes, since the person might have no defense when he or she is taking blood, is taking more of food which is rich in sugar content. Um on type 2 also, type 2 is this type 2 diabetes occurs when some insulin is made. Now the body has produced insulin, but the body cannot use it well. So, but this type is not common. So, since a lot of we have said that it's different from type one. Type one is where we see that the insulin, the body has stopped producing insulin, and on type two, the body is producing is making insulin, but less. So it's not common in to more people who have already who are suffering diabetes. But here are some recommendation for type 2 diabetes. So type 2 diabetes uh, very important to check weight. So a person should manage weight, and the like a person should do exercise regularly in order to maintain the body at in order to maintain weight management. So uh, exercise will help you in a way that when this sugar when a person has consumed a lot of sugar, when a person is doing exercise regularly, this sugar now they are converted. It's like you are helping the body to convert. It's like you are helping the body to uh, instead of insulin acting on it to convert that too much sugar to glycogen, because we know that when too much sugar is produced in the body, it's converted to glucose, and then to be kept to glycogen at the end.
Yeah.
So when you are doing exercises,
Mm.
it's like you are converting some sugars.
Mm.
So it's like you are acting on a law of insulin, which
Yeah.
is not uh, you're helping the work of insulin
Mm.
to convert that blood to convert that sugar in your blood.
Yeah.
Heavy fast is also heavy fast.
Mm.
This also is advice to someone who is suffering from type 2 diabetes to
Mm.
take, and it's very advisable.
Yeah.
Fiber rich foods also is very advisable for
Mm.
someone um, suffering from type 2 diabetes.
Mm.
So all the food that we have said that someone should limit to
Mm.
take at the uh, when you are suffering from diabetes,
Yeah.
it's also the same food that when you are suffering from type 1 diabetes and also type 2 diabetes,
Mm.
they are the same food that someone should avoid
Yeah.
taking. Yeah, so those are the type difference between type 1 and type 2 diabetes.
Okay, so you have talked a lot about diabetes. So maybe finally, what message would you like to leave to our audiences regarding diabetes management and hope? And of course, maybe what advice would you like to give to someone maybe who is newly diagnosed with diabetes now?
My advice I can give to someone who has been diagnosed
Mm.
and well with diabetes
Yeah.
is uh, you should not lose hope.
Mm.
With a balanced diet, you can bounce back to
Mm.
your uh, normal healthy status.
Yeah.
So when you are maintaining the foods, the kind of food that are recommended
Yeah.
at each type, just as we have seen the types of diabetes,
Mm.
uh, within few months you can return to your normal body state. So I just wanted to encourage someone to say
Mm.
uh, my diabetes is at my life is at stake. I've been
Mm.
suffering from diabetes.
Yeah.
What can I do? So uh, you can seek other treatments, like you can go to the hospital.
Mm.
There you can the best treatment is they give you an insulin injection.
Mm.
So which at the end, when you are taking it, uh, your body will be like getting converting those sugar to to converting those excess sugar,
Yeah.
and at the end it's like the body will be eliminating those excess sugar to glucose, and at the end
Yeah.
to glycogen.
Yeah.
So, and also you should maintain that lifestyle.
Mm.
Physical exercise also is, I've said that is very important.
Yeah.
It also acts as the very best way
Mm.
to that can help someone suffering from diabetes.
Mm.
So it's very important for you to
Mm.
monitor the blood sugar levels,
Mm.
so that you should see if your blood sugar is
Yeah.
high or not. So which at the end the doctor will help you
Mm.
to with the uh, proper medications
Yeah.
on your state,
Mm.
according to the level of the level of blood sugar
Mm.
you have gone, that the according to the level of blood sugar you have reached that time.
Yeah.
Yeah, so those are the medications and also the treatments
Mm.
uh, for a person that is suffering for diabetes. Yeah, so regular checkup is very important. So
Yeah.
those are the my advice
Yeah.
to someone who is suffering for diabetes. Sure.
This is the end of our today's podcast. We are talking about diabetes. The doctor has well explained about maybe the foods that one can be taking after he or she is diagnosed with diabetes. I hope the conversation was just clear. Thank you.